My memory does not work like before. It is one of the most common complaints. People say it when they start forgetting things faster, misplacing items, or losing focus. And here is most important question. Is it due to aging or it's dementia or Alzheimer? Because the most painful part about dementia and Alzheimer is that they are not only memory loss. The person slowly loses their identity and self-awareness. They forget who they are, who their loved ones are, and the meaning of their life. Moreover, dementia is not just a memory disease. It is a life-shortening disease because once diagnosed, the average survival is around 10 years, though some live less, some longer. That's why I will tell you how to differentiate benign mild forgetfulness from dementia. I will also tell you proven ways to help improve memory and reduce risk of dementia. For example, if you forget where you have left your glasses, but later find them by retracing steps, or if you walk into a room and forget why but recall after a moment, or if you take longer to recall a word or name but it comes back later, or if you misplace items like key or wallet but not in bizarre place like the fridge or oven. This is usually a sign of normal aging. In dementia, people forget conversations completely, repeat the same questions, or become unable to manage bills or medications. It interferes with daily life. This is a key difference. When it comes to learning, during aging it is possible but slower, and repetition helps. In dementia, learning new information is strikingly difficult, and new routines are quickly lost. The most important difference is during normal aging, a person retains independence. In dementia, the person starts to forget bills, medications, and appointments, and this interferes with daily life. Mild forgetfulness can be caused by stress, anxiety, or depression. For example, when you can't remember where you parked while under pressure because attention is disrupted and encoding never fully happened. It also happened with sleep deprivation. After 2 to 3 nights of poor sleep, short-term recall and learning are clearly worse because memory consolidation needs deep sleep or REM sleep. Certain medications can also affect memory, like antihistamines, bladder medications, antidepressants, and benzodiazepines. They can lower acetylcholine, which is important for attention and memory. In mild cognitive impairment, a person may forget, recall conversations repeatedly, but they are still able to live independently because their hippocampal function is only beginning to fail. But such people have high risk of dementia and Alzheimer's disease. While it's not fully possible to prevent dementia, it can be partially prevented and the risk reduced significantly. That's our mission. In fact, about 45% of dementia cases can be prevented or delayed. First are chronic diseases. Dementia is associated with high blood pressure, diabetes, and cholesterol, and sensory inputs like hearing and vision loss. From lifestyle modification, the key factors are physical activity, diet, social activity, and cognitive engagement. It is also important to treat depression, stress, sleep disorders, and avoid toxins like smoking, excess alcohol, and air pollution. Control hypertension is crucial because blood pressure damages blood vessels in the brain. Keep midlife blood pressure less than 130/80. It reduces dementia risk around 30%. Treat hearing loss. use hearing aids, or maintain social activity. Treat sleep apnea. Night hypoxia disrupts memory consolidation. Treating it reduces dementia risk almost 20%. Control diabetes. Keep glycated hemoglobin less than 7. This lowers dementia risk about 20%. Avoid smoking. Stopping reduces dementia risk 30%, especially if stopped before 60. Limit alcohol. Less than 1 drink per day lowers dementia risk around 10%. Regular physical activity is totally crucial. It boosts synaptic plasticity and brain blood flow, reducing dementia risk almost 40%. And Mediterranean diet, rich in omega-3 antioxidants and low processed foods, protects neurons and lower risk around 30%. Social engagement is important. Isolation weakens cognitive reserve. Staying socially active and protect your memory. Mental activity is crucial also. It reduces dementia risk around 20%, and lifelong learning is crucial because it builds cognitive reserve. Only higher education lower risk around 10%, and ongoing mental activity reduces dementia risk around 15%. Treat depression. Depression increases dementia risk almost 2 times. Reduce obesity. This reduces dementia risk up to 15%. And control LDL or bad cholesterol. High LDL is a newly recognized risk factor. Lowering LDL can reduce dementia risk around 15%. From supplements, effective is omega-3, 1 to 2 grams daily, reduces dementia risk around 15%. Vitamin B12, it prevents dementia symptoms. Deficient vitamin D, low levels are linked to higher dementia risk. And overall, about half of dementia cases can be controlled or prevented. And even if it cannot be prevented fully, it can often be delayed, which is also very important.